So today we are just going to reflect on careers and inspiration and get some of our speakers to offer some advice in terms of careers, just pinch points and highlights in terms of where they've been, just for, I think, pause for thought for people. So I'm delighted, and thank you to everybody who is joining us in terms of giving their insights today. So I think I'd just like to start really just by saying how truly honoured I have felt over my nursing career. So I've been nursing now for 35 years. I know you all look shocked because I'm definitely not old enough for that. You know, I am one of 700,000 registered nurses and midwives from across the country. That's a massive NHS family, isn't it, and a massive workforce. But actually locally, it's not insignificant either. So we have got 424 healthcare support workers, 953 nurses, and about 167 midwives. So about 1,500 of the PAH family are in fact nurses and midwives and part of the nursing midwifery family. And of course, this year we're absolutely delighted. Well, actually last year we're absolutely delighted to welcome nursing associates as well onto our workforce. So we've got 9 nursing associates across the organisation and a further 7 in training. And if we were just to reflect in terms of careers across nursing and midwifery, and we'll hear from some of our speakers soon around that, I think I was just absolutely taken aback yesterday. So we did our long service awards yesterday, and there were 39 of the people who were recognised in terms of long service, 20 or 25 years working at PAH. And 39 of those were nursing midwives or healthcare support workers who have had their career at PAH, and a huge variety of roles. And you can see that nationally in terms of opportunities for our workforce are not insignificant. So 14 different roles just in our organisation reflected across those 14 yesterday. And they range from emergency nurse practitioners to healthcare support workers, associate practitioners, matrons, team leaders, nursery nurses. We have got nurses working in IT, we've got nurses working in our EBME area, just to name just a few. So it's an amazing, adaptable career. And I'm really delighted now just to reflect on that across some of our speakers that we've got with us today. So with no further ado, I'd like to introduce you to Helen Glenister, who's on the line with us. So Helen is a non-executive director here at the organisation, but fundamentally through her core is a nurse. So Helen, can I hand over to you just to talk through your just career highlights and any you'd like to give? Thank you.
Thank you, Sharon, and thank you very much for inviting me to talk about my career. Obviously, I had some set questions to address, and one was, what was my inspiration to become a nurse? Well, I can honestly say it's when I had my appendix out at the age of 13. The nurses were absolutely wonderful, and I sort of tentatively wondered whether I could be part of this profession. Anyway, in terms of my career, I had a plan at the beginning. I very much wanted to be an infection control nurse, but everybody says, well, you've got to do an awful lot of, jobs before you become that. And I did do some, but I very quickly then did become an infection control nurse. And I met Dr. Shiko Visu, our Director of Infection Prevention and Control at the Middlesex Hospital when I started there. But what I wasn't expecting was the fact that within a week, the first AIDS patient was admitted. And we didn't know what we were dealing with. We didn't know what the cause of AIDS was. And there were an awful lot of concerns from health professionals and the public. I did go off to the States to find out what people were doing out there in terms of care of patients, and came back and then developed our own guidelines and worked with the RCN and Department of Health. But AIDS took up most of my time then. So then I thought, well, I still want to be a general infection control nurse. So I went off to Whipps Cross to set up the service. Then there was an opportunity that arose to do a DH funded research project validating surveillance methods. So I did that. And then after that, I had to make some decisions. you know, I was a nurse, I did a PhD. Do I go into academia or do I stay in the service? And I chose to stay in the service because, you know, I just like the contact with patients. Anyway, I had various roles, continued. I also worked at regional level, responsibility for clinical practice, research and development in East Anglian Regional Health Authority, and did have a spell as a general manager, but that didn't quite suit me. I wanted to have more contact with nurses, nursing and patients. So I then became the nursing director of the Medicines and Healthcare Products Regulatory Agency, and doing anything to do with devices. And then from there, I got involved with the National Patient Safety Agency, and of course met Finola, who was also at NPSA. My work there was all about leading a team to reduce the risk of patient safety incidents. So we developed we standardised the crash call number across the NHS to 2222. We had the National Clean Your Hands campaign. We also had developed the surgery safety checklist, introduced the concept of never events, which of course have become embedded into our practice. And if you ask me what one of my highlights is of my career, is really is seeing some of these things become embedded into practice. After that, I went to the private sector and joined an American company and was involved in overseeing programs of work which was brought over from the States, care coordination, health and wellness programs. And I really saw the value of motivational interviewing undertaken by nurses to encourage and support behaviour change. Following this, I went to, I was involved with a health technology company, which I sort of laugh at, me and technology. But anyway, it was the Learning Clinic, and they'd produced a solution, a bit like Nerve Centre, to record observations and assessments. But what I really wanted to do was to use the data to improve the quality of care for patients. Anyway, having done all of that, I then decided to do something a bit different. I wanted to work locally. I live in Bishop Stortford because all my jobs have been in London and Cambridge. And I'm now, as has been mentioned, a NED at PAH, but I'm also a chair of a nurse-led social enterprise, which is focused on leg ulcers and lymphedema patients, and CEO of Isabel Hospice, covering Eastern Hertfordshire. So what would my advice to others be? Well, never stop reflecting and learning. I think I do it most days. And the other thing is, if you identify a role that you really want to go for, just go for it and keep persisting with it. Certainly that happened in the early part of my career. And then the other thing that has happened, and I think is really important, opportunities arise. They come left field. You're not expecting them. And, you know, really do look at them, because they may be for you. So I'll stop there, Sharon, if that's okay. I think that's my 5 minutes.
Yeah, brilliant. Thank you so much, Helen. And I think, you know, there's words in there which traditionally nurses are probably not so familiar with. So, you know, the fact that you've used data to drive some of those real patient safety initiatives is such a fantastic thing to hear. And that's somewhere that we really want to continue to drive that agenda forward in terms of PAH as well, don't we? So people do please put in the chat box if there's anything you want to pick up on as we go along. And I'd just like to thank Helen for that. Just an amazing career, Helen, and fantastic just to hear about the range and scope which you've covered. Okay. Thank you. Thank you. Jane Kinsborough, I wonder if I might come to you now. So we're delighted to have Jane Kinsborough with us today. So Jane, some of you will be familiar with. So Jane was the chief nurse of our local West Essex CCG and has just stepped into the Director of Nursing role for our integrated care system, so the ICS. So this is the integrated world in which we are heading, and we're delighted to have Jane with us today to talk about her reflections on her career. So hello, Jane, can I hand over to you?
Hi, Sharon, thank you. Thank you.
Thank you.
Hello, everybody. Really nice to see you all. I can talk for England, so you probably have to stop me, Sharon, at some stage. So probably just to go back to the very beginning, I am going to give my age away now, but I started my training in 1975 at Guy's Hospital. So I've been in the NHS for 45 years. And there's nobody more surprised than me that I got the ICS role, so I'm just trying to get used to that. And I have to also look to Pam Court, who I know is on the call, because she actually appointed me into my first sort of senior management role way back in Uttlesford Primary Care Trust. So Pam's got something to answer for as well, I think. So probably just to go back to the beginning, I absolutely loved every single minute of my training. Very, very different in those days, done through a school of nursing within an acute hospital. I suppose probably, I think very much like the apprenticeship route. I think we did sort of 2 or 3 weeks in nursing school, and then it was straight out onto the wards. And I remember it really well. You know, you're 18, you've just left school, you're really green. And my first ward was a male orthopaedic, and it was right. I think you're probably all too young, but it was the Moorgate tube disaster. So we had lots of casualties. It was a critical major incident. We had lots of casualties that were brought in. And I can remember standing in the sluice thinking, what am I doing here? And feeling really nervous being sort of catapulted into that world. But as I said, really, really enjoyed my training. Then went on to staff. I think things were probably quite different in those days, but Guy's had a specialist breast unit. So it was actually, they did biopsies, they did radical mastectomies, they had an oncology wing, etc. So they looked after the whole pathway for somebody with breast disease. I staffed there for 18 months, and then it seemed logical to go on and do oncology training at the Royal Marsden. But very interestingly, that's the one thing that I did not complete, because I think I was about 23, and I think it was that realization then about lack of life experience and some of the things you were having to deal with. And at that point, I went to work in the community, and the whole of my career since then has been community based. So I spent 23 years in frontline practice, had no aspiration to be in a management role, but probably had quite a lot to say for myself. And I think, Helen, as you said, opportunities just arise. So was right at the beginning of primary care groups, was very passionate about my role in the community, wanted to make things better, was appointed to that board role. And I think it was almost like a revelation. You know, you've kind of worked in a contained field of practice, but it was beginning to have that exposure to different perspectives. And I think that's the thing that I've taken throughout my career, is actually listening and learning from others, because I think that really just broadens your view, and not just in your own field of practice. So I worked in the community for many years, loved that community role, slightly different from the hospital, because obviously you're a guest in the patient's home. And I think for my final years in practice, I worked 10 years in Thaxted, and it was real community nursing in those days. You knew everybody's relatives, you knew the whole community. They recognised your car when you came to the first patient, and they used to ring and say, can you come and see me too? So, you know, very much part of the community, and absolutely loved that work. And then just towards the end of my career in the community, I did an MSc in advanced clinical practice, because that's what I wanted to do. But again, I think for me, that was quite life-changing. And I think it was that growing confidence. And I think it's the power that knowledge brings, but the power if you use it for the right reasons. So it really, really helped my confidence. And I think the rest of it has really been around, I know I'm not in frontline practice, I know I'm not hands-on, but I still want to make a difference. And I think it's using the roles to be able to try and influence, and very much around promoting the nursing voice. I think some of the policy changes over the years have eroded that nursing voice. And I hope very much through things like the ICS role and the networks that you can build up, that we use that voice to influence. We should be influencing commissioning. We should be influencing that quality agenda. You know, we have quite a lot of, I mean, I know I'm amongst friends and nurses here, but, you know, often our world is medically dominated, but I think we get a much richer service when we're able to input and influence what that service looks like. And so I hope that in the role in the ICS, what I'd really like to be is a conduit from the front line to the absolute board level, so that we really understand what it's like in practice and we can take that to influence some of the conversations. In terms of highlights, I'll be very quick. I didn't do very well at school. I was quite naughty. I never thought that I was going to be able to achieve very much, but actually when I did my training, again, one of the things that I was proudest of, I was awarded the medal in my year for the highest aggregate marks for all examinations. And so having had that kind of imposter syndrome and thinking that you weren't very, able, you kind of suddenly grew confidence and that you were able to do things when you really applied yourself. So that was one of the highlights. I was also very proud of becoming a Queen's nurse, and that's a sort of link to the community. But it's sort of that recognition that you're always striving and pushing for high quality care. Another highlight, probably, it's the only time I've probably done anything very exotic in the NHS, but I went on one of the Kaiser Permanente trips to California in 2005. And again, that was really interesting to see that system, because it's integrated community and acute, which is really what we're trying to move towards in an ICP. But also that trust across the system. And again, Helen, back to the transparency of data, looking at performance and owning that performance that actually drives standards. The other thing that I've really enjoyed in my role in West Essex is actually building a team. And so, appointing people because they've got the right values, and working with those people, because I mean, you're almost like a family. We've worked together now for 6 or 7 years. When I first arrived, there were very few people in the team. So I think we've appointed carefully, we've appointed people with the right values, and it's very satisfying then to watch that team grow and be effective. And my advice to others would be, I know we very often focus on clinical skills, but I think there's something also about understanding the context of your practice. So I would sort of promote that you read more widely, not just around your clinical skills, but look at some of the King's Fund articles, look at some of the direction of travel, and understand your context in that field of practice, and just value each other really, and enjoy your careers.
Wow, thank you so much, Jane, for that whistle-stop tour of your career over since 1975. That's amazing, isn't it? And I really liked your reflections in terms of the power of the knowledge, the power that knowledge brings, but using it really wisely to influence in the right places, and the curiosity in terms of the context in where you're working. Don't be narrow in your thought or your thought processes or what you're looking at. So that's really helpful. Thank you so much, Jane. There's something else. So get you saying as we go through this in terms of the panel members, if any of you want to reflect, if your time is coming up to talk about who in your careers had the biggest impact and why. Sarah, should we move forward to you now? So Sarah's the Deputy Director of Nursing, works at PA8. So Sarah's going to do the same in terms of what nursing means to her. Thank you, Sarah.
Thank you. And how do I follow that, Jane? What an amazingly diverse career. And I was going to start with saying that I feel that mine's been quite diverse, but I can't follow that at all. I will start with saying what was my inspiration to be a nurse, and partly because that's how the slide deck will run. So this was one of the books that we had at home, and those of you that are a certain age would probably have been familiar with this picture on the front of the Ladybird book, People at Work, the nurse. And that picture for me was so powerful. There was no nurses in my family. My mother wasn't a nurse. I didn't know any nurses apart from the lady next door who I visited once a week to have my verruca removed. She had the community nurse with the unpleasant task of doing that. She's the only person I know. But this book was really, really powerful. But reflecting on it now, I actually wonder if it was because I wanted a red coat with a black collar versus actually being a nurse. But that's what started me off on really wanting to work with people and not go to university. That was one of the key things that were driving me. And I think wanting to wear a uniform. So that's how I landed on being a nurse. The the children's bit of the picture on the front obviously kind of directed where I went. So I trained at Great Ormond Street, and at that point you couldn't be a standalone children's nurse. You had to do your adult nursing at the same time. I don't know if you want to you can take the picture off if you want now. So I started on a 4-year course, starting off looking after children. Then we went over to do 18 months in adult nursing, and I did that at the London. And at that point, I probably realised, oh, maybe I've chosen the wrong bit. Maybe I don't actually like looking after children as much as I like looking after adults. But at the end of the 4-year programme, I think it was the breadth of being able to the confidence caring for adults, to be able to talk to parents, and then the confidence being able to look after children, really made me feel that I was kind of set up to do either or. And my career from qualifying has been a combination of children's nursing and adult nursing. So I started on the usual pattern of being a staff nurse, then a ward manager, and then a matron within children's, and then had the opportunity to move over into practice development, and then ultimately into a corporate senior nurse role at Barts. And that was started to develop the workforce, and that was at the point where there was a requirement to really focus on the unqualified workforce, so the healthcare support workers, and the value that they would bring to nursing. But putting some methodology and standardization into the training, the recruitment, the numbers that would make up the skill mix of those teams, and what their career pathway would be. So that was kind of the first step, I would say, kind of out of the staff nurse, ward manager, kind of clinical based role. After that, I think I must have had some kind of moment, because I went from that role into a women's service manager role. I hadn't done gynae since I trained. I had no idea what I was doing, but I think my modus operandi through my whole career is, if it sounds interesting, don't say no, say yes, why not? Let's give it a go, see what happens. And I think some of that is probably the confidence of being a little bit peripatetic and a bit schizophrenic as a student, where you had no idea where you were going. You would just turn up on a ward. It could be a fantastic ward manager. It could be a very challenging ward manager, and you just had to get on with it and deal with it. So I think some going into that gynae role was a kind of a little bit of a step into service management, as well as have the clinical responsibility for a service. And that gave me an insight into management, as well as governance and patient safety, because that role picked up patient safety as well. So that was hugely interesting, and I found that really, really fascinating. But at that point, thought, no, it's time to move on, and ended up having another sidestep into adult orthopedics. And if I say to you that I did a lot of orthopedics in my training, both pediatric and adult, and hated every single minute of it, I don't actually know why I ended up at the Royal National Orthopaedic Hospital. And I kind of did say that at my interview, but they still appointed me. So there I was managing the private patients unit, pediatrics and outpatients. So again, kind of starting to have a different aspect of the way services ran. It was a specialist hospital. There's the challenges that you get working within a multidisciplinary team within a specialist hospital is very different from a district general hospital, from a teaching hospital. And it's always the people that you work with, the friends that you make, but also the professional challenge that you have, and how you present nursing within that multidisciplinary team is hugely valuable. And you have a different skill set, I think, within those different environments as well, and you learn to adapt and to fight for nursing, but within that different context. So after that, I went into a role which is equivalent to the ADON role that we have here, but it was at an integrated trust. The role was covering children, so again, it's kind of back in familiar territory, support services, which were new, but it was also covered community children's services as well. So the first couple of years, there was 2 of us. So there was a ADON for community children's and myself for acute. And then the powers that be decided that it would be 1 role. So I then ended up covering health visiting, school nursing, children's community nursing team, safeguarding, which was completely new. But when I reflect on what my career highlights are, actually that is one of the highlights, because it was something that I wasn't expecting. It was something that I had never thought in a million years I would end up in supporting community nursing teams. But the power of what they did, you cannot underestimate it unless you work with them, or you really see what they do. As Jane said, you know, being a welcoming visitor into a family's home, or having an insight into their family, is such a unique and privileged position, and it gives you so much insight into them when they come into an acute setting as well. I think it was humbling. It was truly humbling to see what they did. So one of the career highlights, although it was one of the biggest challenges, was about 2 months after they'd asked me to take over community services, the community services went out for tender. So those that you know, health visiting was transferred over to public health when the local authorities, and they decided that they needed to go through the whole tendering process for services. And Hackney, where I was working, was one of the first ones to do that tendering process. So I was asked to work on the bid, put together a new model, and although we'd been the incumbent provider, there was a lot of feeling, I think, that we needed to do something differently. We needed to present ourselves in a different way if we were going to be successful in the bid. So after 3 months of no idea what health visitors did, I was leading with a senior team that then decided to retire because they felt it was too much. I ended up leading the bid for health visiting services, and that was the largest challenge, but the biggest area of satisfaction, I think, to date in my career. And that enabled us, when we won the bid, to work with public health team, with social care, really to shape children's services within Hackney. And that's probably one of my biggest career highlights. And again, I think a unique insight into how integration truly works and the powers of integration. And I think hopefully as we move forward, I can take some of those skills with me into that new integration world. So finally, my advice to others who want to progress in their nursing careers, I think don't say no, as Jane said as well. If something comes up that's interesting, explore it. Don't, see what you can do and maximize that diverse experiences and opportunities, because everything is valuable and you can take learning from whatever you do and take it into your next role. Some people have a clear career goal at the beginning. They know where they want to be. Some people, it's an organic development. Jane and I, it clearly was organic, probably for Helen as well. But either route is okay, and it's okay to step sideways, step off, step doing something different. It's about that experience and those challenges. And ask questions and be inquisitive. And there's so many roles, if you heard from the three of us already, there's so many roles out there that we are so lucky to be able to step into those different things and have that richness of experience and a richness of career. And I guess my advice for kind of junior staff who's feeling, how can I step out of the ward environment? I want to move to something different. How do I do it? And sometimes it can feel that you get knocked back because you put your application form in and you're not successful. So my advice would be to speak to the recruiter, pick up the phone and have that face-to-face conversation or Teams conversation now, and talk to them and describe the skills that you've got and how that can best fit the role. Because sometimes we have so many skills and attributes as nurses, but it's just helping you shape that will help you move that career bit on a little bit. And I'll pause there.
Wow, thank you, Sarah. Your experience sounds like you've lived for 50 years in nursing and midwifery, and I can't believe you're old enough for that. But that's an amazing, diverse career. So thank you for sharing that and for your wise counsel in terms of how people should approach the how do I move on to my next step. Yeah, really wise. Thank you very much for that. So we're running quite tight for time, everybody, and that's because I think everyone's got such a diverse careers, and it's amazing to listen to everybody. So Sarah was now going to give a whistle-stop tour just in terms of where we are across our nursing vacancy rates, just to reflect on, as an organisation, where we are headed and where we've come from. So Sarah, can I ask you to hand over to that? And then could I just put that challenge out again to those people that are coming up next? I think we're going to be doing a speed dating exercise across the next cohort of talking about their careers, about specialising, just to think about, get this challenge as well about who has inspired you and why. Thank you, Sarah.
Sorry, I think nurses talking about their career history is always a fascinating thing, isn't it? We can talk for hours. Okay, so reducing our nursing midwifery and AHP vacancy. I think it's probably, most people are familiar with the fact that about 18 months ago, shortly after Sharon and I joined, the overall nursing vacancy rate was 26.8%. We had a significant vacancy rate at band 5s of 40.5%, and that was a picture that had been well embedded at PH. That was the kind of the norm and had been for a number of years. So the challenge was to reduce our vacancy rate to less than 10% over the course of last year, and you can see from that we did. So we got down to 8.6 with a nurse band 5 vacancy rate of 10.3. It's gone up slightly August this year, so the numbers are up there, and that's partly, or actually that is completely driven by the fact that we've increased our baseline establishment as part of the annual establishment review. How did we do it? So we have appointed an additional 231 nurses, and you can see 187 are international nurses and 50 are our own homegrown students or our healthcare support workers who've gone on AP and top-up apprenticeship pathways into nursing. But that's fantastic that we've been able to offer those opportunities to our own staff, as well as recruit more of our students than ever before, and that's our plan moving forward. So our nursing strategy is to get to less than 1% by next year. So Sharon doesn't set me difficult targets at all, but next year that's the aim. So we've got about 7 months left to get there, and we're on target to do that. So if we go to the next slide, you can see that how we did it was, so there's probably, in my view, there's no rocket science about recruitment. You just have to be persistent, and you have to have a plan, and you have to stick to the plan and use the evidence-based practice that's out there. So a lot of hospitals have done this successfully. So speaking to them and taking the best of what's out there and shaping it for what we need to do for our own organisation. So we identified the number of staff that we needed to meet the target, and we put together a detailed plan as to how we were going to do that and what that would mean month on month. We worked closely with one main agency, and I think that for me is really important, because to have an agency that you trust, to have a very good relationship with, actually underpins the whole of your recruitment program. And we were very lucky to have one agency who were able to do that for us. We had a consistent and honest message about why PAH. So the international market is very huge for nurses. They can choose from going to a London teaching hospital, to a specialist trust, to anywhere in the country, really. So to be honest about what PAH has to offer is really important, so they can make an informed decision, because that's going to impact on your retention rates later on. And when we went out to India in July last year, I was very honest to all of the applicants to say, you know, we are a small district general hospital with big ambitions. We're on a journey. It is challenging, but we will support you to develop your career with us. Living in Harlow is a very supportive community. And if you want to bring your family, it's a very family-friendly hospital and environment to live in. If you think that you want to, you know, kind of, you know, to have the big bright lights of London or have access to a huge teaching hospital, then don't come here. You know, it's about being honest with people and so their expectations are met. We opened up our applicants to direct applicants as well, so we didn't just use the agencies to recruit our nurses, and that was successful. About 20% of our international nurses came through direct applications, and we had weekly Skype interviews going on so that we constantly had our pipeline, and we had our pipeline so that we had 40% more people in our pipeline than we actually had vacancies for, because we know what the dropout rate is. Like I said, we went to India back in July, and we took 4 band 7s from across the organisation who were all originally from India. And again, that was another way of being honest with our message of PAH and being able to see what their journey was as well. So I think the candidates really valued that. So I'll skip on because I'm sure I'm running out of time. So the accommodation offer, the onboarding, and a really highly successful OSCE program has also been kind of key to underpinning our successes. So finally, on the last slide, if we move on, so some of the new roles, which I think Sharon has already touched on, but we've had 9 nursing associates qualify, which is absolutely fantastic. And all of them, well, one, I think, is going on to a top-up to degree nurse program. We've had 14 assistant practitioners working in nursing in AHPs as well. We've got 23 NAs and APs on the 2-year top-up program. So that means in 2 years' time, we will have an additional 23 nurses that will have homegrown, as well as 7 more nursing assistants and nursing associates in training. And we've just started recruiting to our degree nurse apprenticeship program, which is directly recruiting onto our program. And we've got 16 degree nurses that are just at the start of that program. So again, in 4 years' time, we will have another 16 nurses and the intention is to grow more every year, as well as a very healthy international nursing pipeline. So I think that we hopefully, obviously, you can see that we've been successful this year. Hopefully, that assures you that we will get to our less than 1% by this year, as well as a healthy plan for how we maintain it. And I'll hand back to Sharon.
Yeah, brilliant. Thank you so much, Sarah, for going over that. And fundamentally, the reason we're doing this is because stable workforces that work in partner teams deliver the best outcomes to patients. You know, happy staff means happy patients. So really important part of the strategy. So the nursing midwifery and AHP strategy is in its final draft, and that will be published soon, and this is absolutely part of that strategy. And then the other thing just to reflect on, which I'm really acutely aware of, which is also part of the strategy, is that the diversity and the BAME network is not well represented across senior network. It's very well represented across nursing and midwifery. So my absolute strategic aim as well is to proactively promote those people in our BAME network as well to get into more senior leadership roles. So thank you, Sarah, for running us through that. So we're now going to go into our Think About Specialising speed dating programme, which I think Jo Ward's going to host for us. Is that right, Jo? Is that what you're expecting?
Well, I'm not sure I was expecting to host it, but I was certainly going to introduce it. And if someone just reminds me who's coming up after me, I would certainly like to host and tell you who's coming next. So without further ado, I'd just like to say the things that have led me into specialising my career were patients, and there's certain patients that stuck out for me. So I have a background in cardiology. I then specialised in cardiology, in acute cardiology, and in heart failure. And actually, it's certain patients that really stuck with me, which now gives you my passion for supporting and delivering service within my own healthcare group, including end-of-life care. I think I echo Helen's sentiments in saying the only other advice for me is don't miss an opportunity. And the other part is don't be afraid to take a step backwards if it's really what your passion is for, i.e. if you see that there's a speciality you wish you'd gone into, if an opportunity comes up and it isn't where you are in terms of your grade, don't be afraid to take a step backwards, because other opportunities will come your way and you will be more fulfilled in your career if you do take those opportunities. So I would like to introduce our next speaker, and I don't know, I think, is it Callie Bruce? Who's next?
I think Jackie is poised. So Jackie Featherstone.
Yeah. I'm very sorry. So, so Jackie Featherstone, who is our Associate Director of Nursing and Midwifery.
Hi, so I'm Jackie, and I'm a dual trained. So I'm a nurse, and I qualified in the 80s, and then I trained in London, and it was really about, because I went into nursing because I didn't like what I was seeing. I had a small space in hospital as a child, and I just didn't think that the nurses were caring enough, and it wasn't what I was expecting, and it obviously stuck with me because that was what I was going to do. I needed to change things and make a difference, so that's why I went into nursing. Absolutely loved my training, and then after a couple of years I felt I wanted to do something else. I didn't enjoy my obstetrics in my
physio, so I'm a physio by background, started when I
exciting opportunity, really exciting opportunity. And there was some succession planning going within cancer services, and set up band 6 posts as progression into a CNS role. So I thought it would be a really good learning opportunity, and with my background in ITU, it was the perfect opportunity. So I started in the acute oncology service, and we grew it. So it's a very nice service, and we grew that service from scratch, myself and another nurse, Katie. And it's just been, every step of the way has been exciting. We've really started to deliver a good service within oncology inpatients, because we don't have oncology wards. So we've really tightened up that service and to support our patients within the hospital that come in with acute problems to do with their cancer and cancer treatment.
And one day I went to work and I was so overwhelmed. I sat in the changing room and bawled.
And he caught his arm on the side of a sink and bled profusely because the bung fell off of his Benflon. And I didn't know what to do. PAH. We've got a great team now and we're going to deliver great things in the future. And I'm really humbled and proud and privileged to work with you all. So thank you very much. And thank you to everyone that's joined us today. And thank you very much to our guests. So thank you, Helen and Jane, Sarah, Jo, Jackie, Callie and Finola for sharing your insights. Thanks very much, everybody.